here is what is the logistics of phase 1A? First, just the phase 1A, because there are a lot of healthcare workers who may not be associated with a hospital. So I'll read a couple of questions. The first one on my sheet here is COVID vaccine for dentists. When, where, how? The second one, I'm a 75-year-old and am a psychotherapist in private practice treating mental health issues, many times COVID. When will I be eligible? Another one is from again, an older a neurologist who basically is 76-year-old, but does only 10% in person, and he's not associated with a big hospital. So although we have heard from some especially dentists, practicing dentists, that they have been able to access it. One more question, having difficulty accessing the Stanford Hospital to find a location. They never answer, very, very long wait, very confusing, please help. So these are questions in terms of logistics of 1A, people who are healthcare workers who are clearly eligible, but they don't know what to do.
Yes, great questions. So as you point out, yes, dentists are in phase 1A, eligible in phase 1A. Phase 1A, our Department of Public Health has stratified slightly. As the vaccines come in over the several weeks of phase 1A, the initial priority was to healthcare professionals who are in direct contact with COVID positive patients. And so I think that's a lot of what you've seen so far in the first couple of weeks here. But what's going to happen, including for people who are not affiliated with one of the large hospital systems, is your employer should have had contact from the State Department of Public Health. They should have designated a employee coordinator who is responsible for uploading the roster of eligible employees to the system that's being deployed to manage all this, called VAMS. VAMS stands for Vaccine Administration Management System. It's a new system that's been provided by the CDC, and everyone's getting used to using right now. But in any event, the way this will work is that your employee representative should have instructions from state DPH about how to upload the roster into this system. Once you have been uploaded, you will get a notification email that.
So if I'm a small practice, sorry to interrupt, if I'm a small practice, 2 doctors, 4 doctors, 3, and I haven't heard from anyone, and let's say that I have just one person who's the office manager, do I actually call the state DPH? Who do I call?
Yeah, go on our website, go to ct.gov/coronavirus, and then just navigate your way into the vaccine section there. There's a section, I think it says for employers, and there should be instructions there about how to get in touch with a human being at DPH. If you're having trouble, you can reach out to me as well, or through the representative, and we'll get you connected with the right person if you've somehow fallen through the cracks. But DPH knows who all the licensed providers are in the state, and they keep what should be a current distribution list there. So everyone should have received contact. But if you're not, or if you have questions about some of these nuanced types of jobs, you can hopefully find a lot of information on the website, but if not, feel free to reach out. So then what happens is, once you're in the database as someone eligible in that phase, and this will also be true in phase 1B and 1C and so forth, when your turn comes, you get an email, you are invited to log in, set up your credentials in the system, and then it's kind of like a classic, you punch in your zip code and you'll be presented with a list of sites that are proximate to where you live that are taking appointments for vaccinations. You can see the dates and times that are available, pick one, and then start counting down the hours until your appointment arrives.
That's great.
And then you're off and running.
No.
So there will be, as you would expect, as the amount of vaccine coming to the state expands and the number of doses available grows, we're in the process of ramping up a lot of additional distribution sites. The hospitals will be key players in this. They'll be doing a tremendous amount of the frontline work of doing vaccinations, but so will our local health. Most of our local health departments are going to participate. A lot of the federally qualified health centers, I believe there's actually one in Greenwich as well, will be participating. And then we're looking to stand up some kind of mega regional vaccination sites that, as you get into phase 1B and 1C, when we're talking about much larger numbers of people, that we can really get through this even faster. Anticipating not just that we're dealing with the forecasted quantities of Moderna and Pfizer, but in anticipation that we may have additional vaccines coming online, hopefully as well from the AstraZeneca Oxford partnership, and Janssen is hopefully getting close as well. So going to be an exciting few months.